In this episode of NCLEX Rapid Revision, we're diving into maternal drug-related questions, all of which have been previously asked and are likely to appear again. We've handpicked 15 high-yield questions that could make or break your exam. If you watch every episode of this series, you'll be fully prepared to pass the NCLEX on your first try. So, stay tuned, take notes, and let's get started. Let's move to the first question, which has been asked 4 times. Since it has appeared frequently, there is a high chance you might encounter it in your exam. A postpartum client with a history of hypertension is experiencing excessive vaginal bleeding. The provider prescribes Methylergonovine maleate. Which of the following actions should the nurse take first? A. Assess the client's blood pressure before administering the medication. Methylergonovine maleate is an ergot alkaloid that works by stimulating uterine contractions, making it highly effective for managing postpartum hemorrhage. However, it also has strong vasoconstrictive effects, which can significantly increase blood pressure. Since this client has a history of hypertension, the most critical step before giving the medication is to check her blood pressure. If her BP is already elevated, administering the drug could put her at risk for a hypertensive crisis, which is why the nurse must assess it first and withhold the medication if necessary. So, this option is right. B. Monitor uterine contractions for tetanic activity. Monitoring uterine contractions is certainly important when giving Methylergonovine maleate because excessive contractions, tetanic activity, can lead to complications like uterine rupture. However, before even reaching that stage, the nurse must ensure the medication is safe to administer by first checking the client's blood pressure. So this option is wrong. C. Instruct the client that headache and nausea are expected side effects. It is true that Methylergonovine maleate can cause side effects such as headache, nausea, and vomiting, which the client should be informed about. However, patient education should come after ensuring the medication is safe to give. The immediate priority is assessing blood pressure, not providing education at this moment, so this option is wrong. D. Evaluate for signs of peripheral vasospasm after administration. Peripheral vasospasm is a potential adverse effect of Methylergonovine maleate, and the nurse should certainly monitor for it after administration. However, this assessment comes later in the process. The first and most crucial step is making sure it is safe to administer the drug in the first place by assessing the client's blood pressure. So this option is wrong. Now, let's discuss another commonly tested question which has been asked 5 times. Given its repeated appearance, you should be well prepared for this one. A 32-year-old G2P1 patient at 41 weeks of gestation is receiving an oxytocin infusion for labor induction. After 4 hours, the nurse observes the following. Uterine contractions are occurring every 1.5 minutes lasting 90 seconds with increased resting tone between contractions. Fetal heart rate, FHR baseline, is 170 beats per minute with minimal variability, and late decelerations are noted on the fetal monitor. The patient's blood pressure is 85/60 millimeters of mercury, and she reports dizziness and headache. Which of the following is the priority nursing intervention? A. Increase the oxytocin infusion rate to promote cervical dilation. Oxytocin is used to induce labor, but in this case, the patient is experiencing uterine tachysystole, which is characterized by excessive contractions that can lead to fetal distress. Increasing the oxytocin infusion would further worsen the situation by intensifying contractions and decreasing oxygen supply to the fetus, which can cause further fetal compromise. So, this option is wrong. B. Administer IV fluids bolus and continue monitoring contractions. While giving IV fluids can help with maternal hypotension, it does not directly address the primary issue, which is uterine tachysystole and fetal distress. The nurse must take immediate steps to reduce excessive contractions and improve fetal oxygenation, rather than just monitoring contractions. So, this option is wrong. Command: stop the oxytocin infusion, reposition the patient, administer oxygen, and notify the provider. The patient is showing signs of uterine tachysystole and non-reassuring fetal heart patterns, which indicate fetal distress due to inadequate oxygen supply. The priority action is to immediately stop the oxytocin infusion to reduce uterine activity, reposition the patient to a side-lying position to enhance utero-placental perfusion, administer oxygen via face mask, 8 to 10 liters per minute, to optimize oxygen delivery, and notify the provider for further management. So, this option is right. D. Administer magnesium sulfate to reduce uterine hypertonicity. Magnesium sulfate is not the first-line treatment for uterine hyperstimulation caused by oxytocin. It is primarily used for seizure prevention in severe preeclampsia or for fetal neuroprotection in preterm labor. The correct approach is to stop the oxytocin infusion first, not to administer magnesium sulfate. So, this option is wrong. Here's a question that has been seen 3 times. Since it keeps coming up, mastering this concept will be beneficial for your exam. A nurse is monitoring a client receiving an oxytocin infusion to induce labor. Which assessment findings should prompt the nurse to immediately discontinue the oxytocin infusion? Select all that apply. A. Fatigue. Fatigue refers to a general feeling of tiredness or exhaustion, which is common during labor. It does not indicate harm to the mother or baby and is not a reason to stop the oxytocin infusion. So, this option is wrong. B. Drowsiness. Drowsiness or feeling sleepy or lethargic can occur due to exhaustion, medications, or prolonged labor. Since it is not a sign of fetal distress or a life-threatening condition, there is no need to discontinue oxytocin, so this option is wrong. C. Uterine hyperstimulation. Uterine hyperstimulation, also called uterine tachysystole, is defined as more than 5 contractions in a 10-minute period. This excessive contraction frequency can reduce blood flow and oxygen supply to the baby, leading to fetal distress. Stopping the oxytocin infusion is necessary to decrease contraction intensity and allow proper oxygenation. So, this option is right. Late decelerations of the fetal heart rate. Late decelerations occur when the baby's heart rate gradually decreases after the peak of a contraction and only returns to baseline once the contraction has ended. This pattern suggests placental insufficiency and oxygen deprivation to the baby, which requires immediate intervention, including discontinuation of oxytocin. So, this option is right. Early decelerations of the fetal heart rate. Early decelerations are temporary, gradual decreases in the baby's heart rate that begin and end with a contraction. They are usually a normal response to head compression during contractions and do not indicate fetal distress, so stopping oxytocin is not necessary. So, this option is wrong. Let's go over this important question, which has been tested 4 times. Given its frequency, it's worth reviewing in detail. A 32-year-old pregnant client at 30 weeks gestation is receiving an intravenous infusion of magnesium sulfate for severe preeclampsia. During an assessment, the nurse suspects magnesium toxicity based on which findings select all that apply. Absent deep tendon reflexes, normally our muscles and nerves work together to produce deep tendon reflexes, like the knee-jerk reflex. Magnesium is a central nervous system depressant, meaning it slows down nerve signals. When magnesium levels get too high, the first noticeable sign is that reflexes start diminishing and eventually become completely absent. This is an early red flag for magnesium toxicity. So, this option is right. B. Decreased urine output and rising creatinine levels. Magnesium is primarily excreted by the kidneys. If urine output drops below 30 milliliters per hour and creatinine levels rise, it means the kidneys are not clearing magnesium efficiently. This leads to an accumulation of magnesium in the body, increasing the risk of toxicity. So, this option is right. C. Fetal heart rate of 100 beats per minute with reduced variability. Fetal heart rate, FHR. Variability reflects the baby's nervous system activity. Magnesium crosses the placenta and can depress the fetal nervous system. A low FHR, bradycardia, of 100 beats per minute along with reduced variability suggests that excess magnesium may be affecting the baby. So, this option is right. D-dot serum magnesium level of 8.5 milliequivalents per liter. The therapeutic range for magnesium in preeclampsia is 4 to 7.5 milliequivalents per liter. When levels exceed 7 milliequivalents per liter, toxic effects start appearing, such as loss of reflexes, respiratory depression, and cardiac issues. A level of 8.5 milliequivalents per liter confirms magnesium toxicity. So this option is right. Blood pressure increasing from 160 over 100 millimeters of mercury to 180 over 110 millimeters of mercury despite treatment. Preeclampsia causes high blood pressure, but magnesium sulfate actually helps lower it by relaxing blood vessels. If blood pressure is increasing despite magnesium therapy, it suggests worsening preeclampsia rather than magnesium toxicity. So, this option is wrong. This question has been asked 6 times. Since it keeps reappearing, make sure you understand it well. A nurse is assessing a nursing student's understanding of the correct procedure for administering erythromycin eye ointment to a newborn. Which statement made by the student indicates a need for further teaching? The question is asking for the incorrect statement, meaning the incorrect statement is the correct answer. I will flush the newborn's eyes after applying the ointment. Erythromycin eye ointment is given to newborns as prophylaxis against neonatal conjunctivitis, particularly from gonorrhea and chlamydia. The medication needs to stay in the eyes to be effective, so flushing the eyes after administration would wash it away before it has time to work. Incorrect statement. So this option is correct. B. I will cleanse the newborn's eyes before administering the ointment. Before applying erythromycin ointment, it is essential to cleanse the newborn's eyes to remove any debris or secretions that could interfere with absorption. This ensures proper medication application and effectiveness. Correct statement. So this option is incorrect. C. I need to apply the eye ointment within the first hour after birth. Administering erythromycin within the first hour after birth is the recommended practice to prevent neonatal conjunctivitis before any potential infection can develop. Correct statement. So, this option is incorrect. D. I will instill the ointment into the newborn's conjunctival sacs. The proper technique for administering erythromycin ointment is to apply it into the conjunctival sac, not directly onto the cornea, to minimize irritation and allow for better absorption. Correct statement. So, this option is incorrect. Let's go over this scenario, which has appeared 5 times. Given its relevance, it's likely to show up in your exam. A client in preterm labor at 31 weeks gestation, dilated to 4 centimeters, is receiving magnesium sulfate. Contractions have stopped. If labor remains inhibited for the next 48 hours, which medication should the nurse anticipate prescribing? Nalbuphine. Nalbuphine is an opioid analgesic used for pain management during labor. However, it does not play a role in promoting fetal lung maturity or delaying preterm labor, which makes it inappropriate in this scenario. So, this option is wrong. B. Betamethasone. Betamethasone is a glucocorticoid that helps accelerate fetal lung development by increasing surfactant production, which is crucial for preterm infants. It is typically administered to clients in preterm labor between 28 and 32 weeks gestation if labor can be postponed for at least 48 hours, allowing time for the medication to take effect. So, this option is right. See RhoD immune globulin. RhoD immune globulin is given to Rh-negative clients to prevent Rh sensitization and hemolytic disease in the newborn. While important for Rh-negative mothers, it does not influence fetal lung development or preterm labor management, so this option is wrong. D. Dinoprostone vaginal insert. Dinoprostone is a prostaglandin used to ripen the cervix and induce labor. In this case, the goal is to delay labor, not stimulate it, making dinoprostone an inappropriate choice. So, this option is wrong. This next question has been tested 4 times. Since it is often asked, it's crucial to know the correct response. A postpartum client is prescribed Methylergonovine to manage excessive bleeding. Before administering the medication, which assessment is the priority? Uterine firmness. Assessing uterine firmness is an essential part of postpartum care because it helps determine whether the uterus is contracting properly. However, while important, this assessment is not the immediate priority before giving Methylergonovine. So this option is wrong. B. Blood pressure. Methylergonovine, an ergot alkaloid, promotes sustained uterine contractions to control postpartum hemorrhage. However, it has a vasoconstrictive effect, which can cause significant hypertension. Since high blood pressure is a potential complication, checking the client's BP before administration is the most critical step. If hypertension is present, the nurse must withhold the medication and notify the provider. So, this option is right. See amount of vaginal bleeding. Monitoring vaginal bleeding is crucial in postpartum care to assess the effectiveness of interventions. However, this assessment does not take priority over checking blood pressure before giving Methylergonovine, as the medication itself can cause dangerous increases in BP, so this option is wrong. Deep tendon reflexes. Assessing deep tendon reflexes is relevant in conditions like preeclampsia, where hyperreflexia can indicate worsening complications. However, Methylergonovine's primary risk is hypertension, not changes in reflex activity. So this option is wrong. Let's discuss this question, which has been tested 3 times. Since it has appeared multiple times, be sure to review this concept. A nurse is preparing to administer exogenous surfactant to a premature infant diagnosed with respiratory distress syndrome. Through which route should the nurse administer the medication? First, intradermal. Exogenous surfactant is used to treat respiratory distress syndrome, RDS, in premature infants by improving lung function and oxygenation. However, the intradermal route is used for skin testing and local effects, not for delivering surfactant into the lungs, so this option is wrong. Second, intratracheal. Respiratory distress syndrome, RDS, occurs due to surfactant deficiency, leading to impaired gas exchange, hypoxia, and acidosis in premature infants. Exogenous surfactant is administered directly into the trachea through an endotracheal tube to coat the alveoli, reducing surface tension and improving lung function. This method ensures direct and effective delivery to the lungs. So, this option is right. 3. Subcutaneous. The subcutaneous route is primarily used for medications that require slow absorption, such as insulin or heparin. It does not provide the direct lung delivery necessary for surfactant to be effective in treating RDS. So this option is wrong. 4. Intramuscular. The intramuscular route is commonly used for vaccines and medications requiring systemic absorption, but it is not appropriate for surfactant administration since it must reach the alveoli to function. So, this option is wrong. This question has been seen 5 times. Since it is a repeated concept, it is important to understand the rationale. A nurse is caring for a client in labor who has received an opioid analgesic for pain management. Which medication should the nurse have readily available to counteract potential respiratory depression? 1. Naloxone. Opioid analgesics are commonly used for pain relief during labor, but they can cause respiratory depression in both the mother and newborn. Naloxone is an opioid antagonist that effectively reverses opioid-induced respiratory depression by competitively binding to opioid receptors. This makes it the correct medication to have readily available in case of an emergency. So, this option is right. 2. Morphine sulfate. Morphine sulfate is an opioid analgesic used for pain management. However, it does not counteract opioid-induced respiratory depression. Rather, it could worsen it, so this option is wrong. 3. Ephedrine. Ephedrine is a vasopressor commonly used to treat hypotension, especially in cases of epidural anesthesia. It does not reverse opioid effects or respiratory depression, so this option is wrong. 4. Hydromorphone hydrochloride. Hydromorphone hydrochloride is another opioid analgesic used for pain relief. Like morphine, it does not serve as an antidote for opioid-induced respiratory depression. So, this option is wrong. Now let's cover this question, which has been asked 4 times. Since it keeps reappearing, ensure you know the correct intervention. A nurse is educating a postpartum client about the purpose of rhodomune globulin, which has been prescribed after delivery. The nurse determines that the client understands its purpose when she states that the medication will help prevent which condition in future pregnancies. 1. The baby having Rh-positive blood. The blood type of a baby is determined genetically and is not influenced by Rho-D immune globulin. This medication does not change the baby's Rh factor, but rather prevents the mother from developing antibodies against Rh-positive blood. So, this option is wrong. 2. The baby developing a rubella infection. Rubella is a viral infection that can be prevented through vaccination, but Rho-D immune globulin has no role in preventing rubella. The purpose of this medication is to prevent Rh incompatibility, not viral infection, so this option is wrong. 3. The baby developing physiological jaundice. Physiological jaundice in newborns occurs due to immature liver function and the normal breakdown of fetal red blood cells after birth. While severe Rh incompatibility can lead to pathological jaundice, Rho-D immune globulin does not directly prevent physiological jaundice, so this option is wrong. The baby being affected by Rh incompatibility. Rh incompatibility occurs when an Rh-negative mother is exposed to Rh-positive fetal blood, leading to sensitization and antibody formation. This typically happens during pregnancy or delivery. If untreated, these maternal antibodies can attack the red blood cells of an Rh-positive fetus in future pregnancies, causing hemolytic disease of the newborn. Rho-D immune globulin provides passive immunity by preventing the mother's immune system from forming antibodies against Rh-positive blood. So this option is right. Let's focus on this question, which has been tested 6 times. Since it frequently appears, it's important to recognize the correct response. A nurse is monitoring a client in preterm labor who is receiving intravenous magnesium sulfate. Which adverse effects should the nurse assess for? Select all that apply. 1. Hyperactive deep tendon reflexes. Magnesium sulfate is a central nervous system depressant, which means it decreases neuromuscular excitability. This leads to depressed, not hyperactive, deep tendon reflexes. If deep tendon reflexes become absent, it can indicate magnesium toxicity. So, this option is wrong. 2. Respiratory depression. Because magnesium sulfate is a smooth muscle relaxant and central nervous system depressant, it can slow down respiratory function. Severe magnesium toxicity can lead to dangerously low respiratory rates or even respiratory arrest. So, this option is right. 3. Flushing. Flushing is a common side effect of magnesium sulfate due to its vasodilatory effects, which can cause warmth and redness, especially in the face and upper body. So, this option is right. 4. Increased urine output. Magnesium sulfate toxicity is more likely to cause decreased urine output because it affects kidney function and can lead to fluid retention. Increased urine output is not an expected side effect, so this option is wrong. 5. Severe muscle weakness. Since magnesium sulfate relaxes muscles, excessive levels can cause profound muscle weakness. This can progress to loss of deep tendon reflexes and even paralysis in severe cases. So, this option is right. 6. Hypertension. Magnesium sulfate has a hypotensive effect due to its vasodilatory properties. It is often used in conditions like preeclampsia to lower blood pressure. Hypertension is not a known adverse effect. So, this option is wrong. Here's a commonly tested question which has been seen 3 times. Since it is asked often, understanding the concept is key. The nurse is caring for a client at 28 weeks gestation who is receiving Terbutaline for preterm labor. Which assessment findings require immediate notification to the healthcare provider? Select all that apply. A. Eupnea. Eupnea refers to normal breathing, meaning the patient is not experiencing any respiratory distress. Since Terbutaline can sometimes cause breathing difficulties, normal respiration is actually a positive sign and does not require any intervention. There is no need to notify the HCP. So, this option is wrong. Brain seizure activity. Seizures are a severe and uncommon reaction to Terbutaline, indicating nervous system overstimulation or potential toxicity. This is a medical emergency, as it can lead to complications such as hypoxia or cardiovascular instability. If a patient receiving Terbutaline experiences seizure activity, the nurse must immediately notify the HCP for further evaluation and possible discontinuation of the medication. So this option is right. Cardiac irregular tachycardia, fast, irregular heartbeat. Terbutaline commonly causes an increased heart rate, but an irregular heartbeat is not expected and may indicate serious cardiovascular complications. An irregular tachycardia suggests the heart is under excessive stress, which increases the risk of life-threatening arrhythmias. The nurse must report this finding immediately to prevent further complications. So, this option is right. D. Chest tightness. Because terbutaline affects beta-2 receptors in the lungs, it can sometimes cause chest discomfort or tightness, which may be an early sign of respiratory distress or cardiovascular complications. If left untreated, this could progress to more severe cardiac or pulmonary issues. Therefore, this finding requires urgent medical attention, and the nurse must notify the HCP immediately. So, this option is right. E. Uterine contractions. Every 20 to 25 minutes, terbutaline is given to suppress uterine contractions and delay preterm labor. If the contractions are now occurring every 20 to 25 minutes, it suggests that the medication is working effectively. Since this is an expected therapeutic response, there is no need to notify the HCP. So, this option is wrong. This question has been tested 5 times: March 2019, November 2020, August 2021, January 2023, September 2023. 2024. Since it is a high-yield topic, mastering it will be beneficial. The nurse is caring for a primigravida client at 39 weeks gestation who is receiving an oxytocin infusion at 10 milliunits per minute as prescribed. The nurse observes late decelerations on the fetal heart monitor. Which nursing interventions are appropriate in response to this finding? Select all that apply. A. Prepare for an amnioinfusion bolus. Amnioinfusion involves infusing sterile fluid into the amniotic sac to increase amniotic fluid volume. It is primarily used to relieve umbilical cord compression, which causes variable decelerations, not late decelerations. Since late decelerations result from uteroplacental insufficiency, amnioinfusion does not address the underlying issue. So, this option is wrong. B. Administer oxygen via face mask at 6 liters per minute. Late decelerations indicate that the fetus is experiencing decreased oxygen supply due to uteroplacental insufficiency. Providing supplemental oxygen to the mother increases maternal oxygenation, which in turn enhances oxygen delivery to the placenta and fetus, helping to counteract fetal hypoxia. So, this option is right. C. Increase the oxytocin infusion rate. Oxytocin stimulates uterine contractions, which can further reduce placental blood flow and worsen uteroplacental insufficiency. Instead of increasing the infusion rate, the nurse should consider reducing or stopping oxytocin to improve fetal oxygenation. So, this option is wrong. D. Administer a 500 milliliter bolus of 0.45% sodium chloride, as prescribed. A fluid bolus can improve circulation and perfusion, potentially enhancing placental blood flow. However, isotonic solutions like 0.9% sodium chloride or lactated ringers are preferred for volume expansion, as 0.45% sodium chloride is hypotonic and less effective for this purpose. So, this option is wrong. E. Position the client in a right side lying position. A side lying position, especially on the left side, reduces pressure on the inferior vena cava, enhances uteroplacental circulation, and improves fetal oxygenation. Although left side positioning is generally preferred, a right side position can still be beneficial if needed. So this option is right. This scenario has appeared 4 times. Since it is a key clinical concept, ensure you understand the correct nursing action. The nurse is caring for multiple clients admitted for the treatment of preterm labor. For which client should the nurse question the prescription of betamethasone therapy with the healthcare provider, HCP? What is the question asking? The question is asking which client's prescription for betamethasone should be questioned. Betamethasone is a corticosteroid given to help mature fetal lungs in cases of preterm labor, but in some situations it may not be appropriate or could pose risks. The goal is to identify the scenario where betamethasone might not be the best option. 1. A client who is gravida 4, para 3, with a history of preterm birth. Betamethasone is a corticosteroid that helps with fetal lung maturation in cases of suspected preterm birth. This client has had multiple pregnancies and previous preterm deliveries, which means they are at risk for another preterm birth. Since betamethasone is beneficial in preventing neonatal respiratory distress syndrome, it is appropriate to administer the medication in this case. So, this option is wrong. 2. A client who is currently at 30 weeks gestation. Betamethasone is recommended for pregnancies between 24 and 34 weeks to accelerate fetal lung maturity. Since this client is at 30 weeks, the medication falls within the appropriate gestational window and can be safely administered. So this option is wrong. 3. A client who is 32 weeks gestation with a twin pregnancy. Although betamethasone may be less effective in multiple gestations than in singleton pregnancies, it is still used to enhance fetal lung maturity. If preterm labor is suspected and delivery is imminent, the benefits of the medication outweigh any concern, so this option is wrong. 4th, a client whose membranes ruptured 2 hours ago. Premature rupture of membranes, PROM, increases the risk of infection such as chorioamnionitis. Since betamethasone is a steroid, it can suppress the immune response and mask early signs of infection, making detection more difficult. Because of this concern, the nurse should question the prescription and clarify with the healthcare provider whether the benefits outweigh the risks. So, this option is right. Let's look at this final question, which has been asked 6 times. Given its frequency, expect to see it in the exam. A nurse is caring for a pregnant client receiving an intravenous IV infusion of oxytocin at 15 millunits per minute. The fetal heart rate FHR monitor shows moderate variability with no signs of distress. What is the most appropriate nursing action? A. Contact the healthcare provider HCP immediately. Contacting the healthcare provider is necessary if there are signs of fetal distress such as late decelerations, absent variability, or prolonged bradycardia. In this scenario, the fetal heart rate pattern is reassuring, meaning the baby is doing well. Since there is no fetal distress, calling the HCP is unnecessary at this time. So, this option is wrong. Begin. Continue with the current plan of care. Since the fetal heart rate pattern is reassuring, the nurse should continue monitoring and maintain the oxytocin infusion as ordered. There is no indication of distress, excessive uterine activity, or oxygenation issues. Moderate variability indicates a healthy fetal nervous system and proper oxygenation, so no changes are needed. So, this option is right. C. Administer a tocolytic medication. Tocolytic medications such as Terbutaline or nifedipine are used to stop preterm labor or excessive uterine contractions, tachycystole. Since this client is in active labor with a normal fetal heart rate, a tocolytic is not needed. The client is not experiencing excessive contractions or distress, so giving a tocolytic would be unnecessary and inappropriate. So, this option is wrong. Doctor, stop the oxytocin infusion immediately. Oxytocin should only be stopped if there are signs of fetal distress or hyperstimulation, tachycystole, which includes more than 5 contractions in 10 minutes. In this case, the fetal heart rate pattern is reassuring, so stopping oxytocin is not necessary. Since labor is progressing normally without fetal distress, stopping oxytocin would interrupt labor unnecessarily. So, this option is wrong.